Hello, everyone, and welcome to T1D to 100, a series that we're doing now on living options. Where are you going to live? This is for all insulin using people living with diabetes, as well as medical and healthcare providers that we want to share our diabetes lived experiences with those who will be taking care of us, understanding us, working with us. So today is something that is a major topic that comes up all the time is where are we going to live? Who's going to take care of us? How is this going to work? So we're looking today at life plan communities, and we have Eric Salgado, who's director of sales for a nonprofit called HumanGood.org, and they manage living communities or plan live life communities or life plan communities. He'll explain that. And we'll have plenty of time to ask questions. And I think this is a great opportunity to learn what we need to learn about what's out there. Before we go on, we'll do our normal disclaimer that this presentation is for informational and educational purposes only. It is not intended as medical advice. Please consult your healthcare provider before making any changes to your diabetes management or treatment plan. And that doesn't entirely apply here, except you might want to bring this topic up with your healthcare providers because you'll learn some things today. Guidelines for our discussion, questions are very much welcome. Please put them in the chat and I will read them, or someone else will share some of these questions and share them with Eric. Please keep your microphone on mute so we don't hear barking doggies, although I love that, or doorbells or whatever. Just keep your mute on. And if you have any difficulty understanding, there is a way to run a text stream so you can see that as well. This session is being recorded and it will be shared on our YouTube channel, and we will share that as soon as it is edited. Let's talk a little bit about T1D to100. It is a community and it's been described as a movement at this point, dedicated to supporting, educating, and empowering people aging with type 1 diabetes or those using insulin to manage diabetes. We believe that living well with T1D at any age is possible and that no one should have to navigate this alone. Why do we exist? We exist because the population of type 1 diabetics is growing, and we are now the majority of people living with type 1 diabetes. It didn't used to be that way. It is now, and the resources and the support have not kept up. Type 1 diabetes and aging are a combination of unique challenges. If you are in that demographic, you will know that there are unique challenges, and they deserve attention and support in the community. We truly understand what it means to live decades with this condition, and we're trying to connect cutting-edge research and the expert voices directly into our community to learn from us, and we can share with them. So today's discussion, I'm so happy to be able to present this. It will be an in-depth and informative conversation about life plan communities. That was a new phrase for me last week, and it's what I used to think of as retirement villages or continuing care retirement communities. So we'll cover topics like what is a life plan community? How does continuing care work? Are there life plan communities to accommodate people living with insulin requiring diabetes? What is a 602 form? And then there'll be a Q&A at the end. We will have time, and again, put your questions in the chat. Our special guest today is Eric Salgado. He's Director of Sales at Regions Point, which is a life plan community in Irvine, California, and part of a corporate group called Human Good. He has spent the last 18 years serving the senior living communities, including assisting over 100 families relocate into the life plan community, involved in every step of the process. This man knows this process, and he educated us last week, and it was quite a journey to learn. He is a native of Orange County, California, and does not plan to ever move from this paradise we call home. I agree with him. And a side comment, he also has a precious doggie named Milo. So that just talks to my heart. So we're going to move on right now. I'm going to stop sharing and I'm going to turn this over to Eric.
As Joanne shared, my name is Eric Salgado. I've been at Regents Point here in Irvine, California for almost a year and a half. I did serve my previous life plan community for almost 16 years. I'd like to say that I am well versed when it comes to life plan communities. Sometimes people use the term CCRC. Intermittently, I'll kind of go down what that means. The term CCRC and life plan is used interchangeably. There's a reason why, but I'll explain that as well. I am pulling different slides from the presentation that I have used here at Regents Point. I'll change it, tweak it a little bit.
Absolutely.
Um, the big question, and I did see it on the chat, what is life plan or what is a life plan community? Um, when you hear the term CCRC, that stands for Continuing Care Retirement Community. So now the new fancy term that we like to use is LPC, Life Plan Community. At the end of the day, whether you are looking at CCRC or a life plan community, there is an overlap of what is provided at such community. So most life plan communities do include all the levels of care. So independent living, assisted living, memory support, and skilled nursing. There are sometimes communities that don't have all these levels of care and they are still classified as a life plan community. In my personal opinion, if someone is looking to move to a life plan community, they really should be looking at having all the levels of care there. It's one-stop shop. At that stage in your life, no one wants to move around, from one end of town to the other end just because they don't have assisted living, as an example, or skilled nursing. Independent living, residents come and go as they please. I will preface that with a life plan community will have a minimum age to move in. So the minimum age is 62 in order to live at a life plan community. Usually the transition is somebody might be living at a 55 plus community, and then this is going to be the next stage in that move process. Now, most residents do move into independent living, and then as their needs change, they do move through the levels of care. So usually somebody starts in independent living, then they go to assisted living or memory support, and then at the end of life would be skilled nursing, which is long-term care. So a lot of times there are alternatives. So if somebody cannot move to a life plan community for one, financially, you do have to qualify financially usually to move to a life plan community. There are three different communities. Really, there's two, a type A contract and a type B contract, which I'll talk a little bit more as we progress through the slides. There are other options. So if you do not qualify for a life plan community, or if you feel that you don't need a life plan community, maybe you're not at that stage quite yet. So there are alternatives. You can have home care. You can have, in-home care come into your residence. You could look at a 55 plus community. Typically, a 55 plus community is not going to have services. So they might have activities, they might have a clubhouse, they might have plenty of activities, they might actually have a golf course too. But the services and amenities that would be missing would be housekeeping, meals, nursing, attention on site, I should say medical attention on site. Those are going to be missing from those 55 plus communities usually. You could move in with a family member, but usually when I ask people if they want to do that, the answer is no. People like their independence, they like their own space, so that's usually not a favorable option. There are freestanding assisted living communities, and there are standalone skilled nursing communities. Now, if you're looking at a freestanding assisted living community, you're not going to likely have the higher level of care, which is skilled nursing. So you have to consider that if you're at a freestanding assisted living community, God forbid you have a fall, you break something, you go to the hospital, then you're going to need rehab. So then you're ending up going from the hospital to a skilled nursing and then skilled nursing back to your community. So it's just a lot of movement, which at the end of the day, it's just more ideal to move to a life plan community. So a lot of times people say, what does ready look like? Or they ask, what does ready look like? Because they feel like they're not ready to move to a life plan community. So
Eric, is there a way to turn up your mic at all?
turn it up.
Yeah,
Sure.
that'd be
Thank
cool.
you.
Thank you.
Sure. Let's see if that helps. And I can always talk. Oh, there we go. How's this?
Yeah.
A little better?
Mhm.
Okay, I can go up a little bit more.
Please.
Okay, how's this?
We'll take it.
Okay, thank you. Just jump in anytime, Joanne, if you need me to
Okay,
speak up. Okay.
sure.
As I was saying, there's the big question oftentimes about when is the right time to move to a life plan community. I will go back to what I mentioned about the type A and type B contracts. So a type A contract will consist of a community, a life plan community, that usually is more expensive, but there are benefits where you know exactly what to expect when it comes to your costs on a monthly basis. A life plan community will usually entail you pay a entrance fee, which is a one-time fee up front, and then you have a monthly service fee. So your one-time entrance fee is usually a bigger chunk of money that you're paying up front to move into the community. And then your monthly service fee covers the ongoing monthly expenses, such as housekeeping, meals, transportation if you no longer drive, you have maintenance at the community, all of your utilities, electricity, water, cable TV, usually Wi-Fi, those would be covered under your monthly service fee. So at a type A community, your entrance fee is going to be significantly higher, as well as your monthly fee. But as you continue to live at that community, your monthly fee will not change. So at the time you move in, they might say, well, your monthly fee is going to be $6,000 per month. So that will not change as you move through the levels of care. So when you go to assisted living, that won't change. When you go to memory support, that won't change. The caveat there is that you do have to meet some medical standards when you move into the community. So there is, and that was the other question that Iris sent over to me. What is a 602 form? So whether it's a 602 form or a physician's report, here in the state of California, we usually call it a physician's report. Most communities will require some version of this. It does have some variations from state to state, but it is a form, a pretty standardized form that your personal primary care physician will fill out. And the life plan community will require that it comes from your primary care physician. What we will then do is review it and ensure that what we have to offer at our life plan community is enough for you and your needs. Now, where type 1 diabetes comes into play here, and oftentimes a misconception is, will I be turned away if the physician's report says I have a diagnosis of type 1 diabetes? And the answer is no, not necessarily, but there are some regulations that we have to follow. So here in the state of California, there's Title 22, and in a life plan community, if somebody's planning to come in, and let's say that, and this is just one example, let's say they are insulin dependent, and this is where I will appreciate any feedback and education as I learn a little bit more from type 1 diabetes. As an example, if someone is insulin dependent, they will need to provide proof that they can handle and manage the insulin on their own. We cannot have a caregiver managing insulin in a life plan community where it's at the independent living or assisted living section. Now, skilled nursing is a little bit different because we would have a nurse available to assist, depending if it's an LVN or an RN. So it's a little different there. But we can't, as an example, have a caregiver in independent living come in and handle insulin for that resident. So it is a common misconception that just because of that diagnosis, somebody's going to be turned away from a life plan community. That is not the case. We do take that as a case by case basis. Now, I'll jump over to a type B community as well. So a type B community is going to have a lower entrance fee and a little bit of a lower monthly service fee. But as you transition through the levels of care, so as you transition from independent living to assisted living, your monthly fee will go up. So you're getting more care in assisted living, and your monthly fee is going to go up because of that increase in care. A type A contract and a type B contract will vary based on their requirements financially for the community. Keep in mind that if you're looking at a type A life plan community, they will take into account if somebody has type 1 diabetes, as an example, they will take into account that likely there will be some cost associated with the care of that individual. So that means that in order for them to qualify you as a resident, they will have a little bit more stringent financial standards for your financial application. A type B community will be a little bit more lenient because we know that this resident will understand that they have to pay whatever that cost is when they move to that higher level of care. Everybody okay so far? I know that's a lot of information to absorb at one time. Okay. I work at Regents Point, and we are a Type B contract. So we do have all the levels of care. We do take into consideration any type of diagnoses in the physician's report when somebody does move in or applies to move in. And then their financial application will kind of go through a review to ensure that we do have what the resident needs for their care needs. And financially, we hope they will be okay until they do pass at our community. At our community, we are, like I mentioned, we are a Type B contract. And so what that means is we have a lower monthly fee and a lower entrance fee in comparison to local Type A contract communities in our area. That being said, when somebody does move into our community, we go through the same process that any other community does. We request that physician's report, also known as the 602 form, and we do ask that the resident come in for what we call a wellness interview in order to medically qualify them for our community. So I'll kind of pause right there. I do just want to check over the chat to see where we are.
A real question you had mentioned for people with type 1 diabetes or insulin taking diabetes, the requirement is that they be able to take their insulin. What about CGM or continuous glucose monitor, which is not giving medication, but it's a device that sometimes people as they age need a little support getting it restarted when they need that?
So, and I'll pull up my notes here. I'll answer twofold. One is if, as long as the resident is able to handle that on their own, there will not be a problem. According to Title 22, if there is, and again, this is where I will be educated on these devices and how they are used, as long as there is no, and I want to get this right, as long as there is no penetration of the skin. So I am not familiar with these devices, so correct me as I communicate. But if there is any penetration of the skin, it cannot be done by a staff person here at the community. Does that make sense?
Yeah, could we bring in a family member to do that? Or does it require that we actually do it as the resident?
That is where it's going to fall in that gray area. It's going to be community based by community based. So there are some communities that have no problem with that. I will share that California has very stringent standards. So likely a community in California will say that is not allowed.
Oh, interesting. Not allowed, and then therefore you could not be a resident. You would not be
There,
accepted.
there are ways around that. So
Yeah.
what we would say, like if you were asking me that question here at Regents Point, What I would say is you would probably need to hire a nurse to do in-home care for that, or you would have to go to another medical establishment to be able to take care of that if you were not able to manage that on your own.
Okay.
Okay. All right. So I'm just looking through the chat here. Life plan community, we've kind of covered most of it. I'll continue my conversation on that. Under what circumstances are folks with uh, type 1 diabetes screened out of various life plan communities? So I kind of answered that. Through the 602, we would ensure that there are um, uh, that the standards are met when somebody is applying to meet to come into the community. But again, those standards and those needs are going to vary community to community. Joanne did input there. Humangood.org is nationwide. So I'll share a little bit more about Regents Point and then what you can kind of expect when you're looking at life plan communities. Regents Point is part of a bigger organization called Human Good. I don't know if you can see that I'm wearing the shirt today. Human Good manages and operates 23 life plan communities across the country. So we have communities in Washington, Oregon, Idaho, California, Arizona, Nevada, Massachusetts, and Pennsylvania. So 23 life plan communities total. Now, if we're looking at other type of organizations that operate and manage life plan communities, we are relatively small. There are other names like Continuing Life, um, front porch communities. If you've heard, those are two biggies, I would say. They manage and operate dozens, sometimes hundreds of communities across the country. So it is a big enterprise. It is a lot of work to manage life plan communities. They're all going to be very different. But Human Good has 23 life plan communities, but you can likely, and I'll be curious to see where everyone on this call is from, but you can likely find multiple communities given, whatever state you live in.
And I would assume all of human good facilities are not equal. They're
No. So
okay.
so human good communities, they're all going to be type B. So we don't have any type A communities in our portfolio. They're all type B, but they are going to vary in size. They're going to vary in cost. So, here we are in California. Our pricing is going to be a little bit more expensive than a community in Idaho, as an example. But yes, they will vary. So even though they are all under the human good umbrella, they will vary. Let's see.
Okay.
So a few more questions. What does it take to qualify for a life plan community? So that is a biggie. Um, Keep in mind that this will vary across the board. So with our community, what we ask is a financial application to be filled out, and we go ahead and process that. And ultimately, what we do is we input all of your information. So it is confidential and it is financial information that we ask from you in regards to assets and income. We look at everything. So you have banking accounts, you have investment accounts, and then what you receive maybe from Social Security slash a pension. And we input all this information into a computer system that will basically give us an ending margin. So it basically guesstimates, based on your age and your gender, how long you will likely have enough in terms of assets and income to last you through the rest of your life. Now, not every community does the financial application that way. There are some communities that have like a threshold, a benchmark, where as long as you meet this in terms of assets, you're good. Or as long as you have this in terms of monthly income, you're good. But we are a little bit more analytical. And so we do take those numbers into consideration for financially qualifying somebody for a life plan community. This is a very good question when you're looking at the differences between a type A life plan community and a type B life plan community. A type A life plan community is going to require you to have significantly more money in assets and significantly more money coming in income. The reason why is because they want to ensure that if anything does happen to you medically, you have hopefully enough assets and income to cover that. Keep in mind that a type A community, your monthly fee starts here when you move in and it doesn't change. So let's say your expenses become higher, they are basically the ones footing the bill. At a type B community, the standard financially is going to be a little bit lower in comparison to a type A community.
I have a very silly question.
Go ahead.
The difference between a type A and a type B community, I understand your assets need to be higher in a type A. Are they snootier? Are they less friendly, or does that not enter into it?
That is a good question, and I will base that answer on my experience. So here in Irvine, we're in Orange County, Southern California, and we have a few life plan communities here in the area. So South County, and I won't use any names here, but South County, there is one that is fairly new, and it is a type A, and it has all the bells and whistles. The way I'll answer this is the general resident population is made up of retired doctors, retired attorneys, maybe uh, movie, newspaper, retired movie, newspaper, sportscasting professionals. So the atmosphere and the conversations you'll likely have at these communities is a little different. Whereas maybe a type B life plan community like ours, you have retired teachers, retired librarians, retired city workers, some medical professionals. So the demographic is definitely different. I always encourage people to visit both a type A contract community and a type B contract community. Because as soon as you walk in through the community, within the first 5 minutes, you'll likely be able to see the differences in terms of the resident interactions.
Okay, that's great.
Okay,
Thank
good question. Going down the line, do type A communities offer on-site health/medical care or resources? Yes, both type A and type B communities offer, even in independent living, medical assistance to those residents that need it. Now, when you move to assisted living and memory support and skilled nursing, those medical services are only going to become larger. So the capacity to treat and assist residents just becomes greater. But yes, a type A community and a type B community is going to offer on-site health and medical resources. Let's see, Maddie asks, what is the range of financial resources needed to qualify? To what extent does Medicare and maybe eventually Medicaid play into this equation? So I kind of rambled there, my apologies. That is a very good question. And so uh, at a life plan community, when you move into independent living, there is an expectation for you to be able to pay for your monthly fee as well as your entrance fee with your own assets and income. Medicare and eventually maybe Medicaid do not come into play when it comes to independent living, when it comes to assisted living, when it comes to memory support. It is an out-of-pocket expense. So, financially, what that means is that if you do need to rely on Medicare or Medicaid, likely you would be that resident would need to be at the skilled nursing level, or the resident has to look for a community that might not be a life plan community. So, on the other end of the spectrum, there are affordable housing communities, and there are communities that might take vouchers. So, if you're looking at an assisted living community or a memory support community, depending on the county, there is a voucher system that would be able to provide financial assistance for those individuals that need it. Continuation here, as one progresses from independent living to assisted living, how might costs increase and why? So the cost increases because the resident is getting a lot more care. How much it would increase, it really is dependent on the community, the needs of that resident, and also the location. So pricing will vary across the board. As we all know, California is an expensive state. So pricing will be a little bit more in comparison to a community maybe in New Jersey or Colorado, right? So it will vary it will be location dependent.
Are
Uh,
you able to give some examples of move-in costs and monthly
yep.
at your place, or kind of what the average is?
Yes.
Okay.
So I'll base that answer on here, basically Orange County. So even in Orange County, which, as I shared in my bio, I consider it paradise. Um, Even in Orange County, there are communities that are less expensive, and there are communities that are definitely more expensive. So with Regents Point here, as an example, a type B life plan community like us, the entrance fee would hover right around $130,000. So that would be your one-time fee to pay when you move in. Now that is in a studio, so it is a more economical option. It is a smaller option. The one-time fee is 130,000, and then your monthly fee would hover right around $4,000 per month. So you have your one-time entrance fee and then your ongoing monthly fee. That is for independent living. As you transition to assisted living, your monthly fee would likely jump from $4,000 up to $9,000 per month. That means that you're getting significantly more care. As an example, in assisted living, you might get assistance with bathing and dressing because you no longer can manage that on your own. Assistance with medications. Maybe you're becoming forgetful and don't know when and how much of something to take. So, for your own safety, your medications are managed. Assistance getting in and out of bed, getting to and from the dining room. So, it is more care that you are paying for. That is an example here at Regents Point. Now, I've been to communities here in Orange County where the entrance fee is closer to about $90,000, so it's a little bit less. And then your monthly fee is anywhere between $3,000 to $3,500. So it's less expensive. Now, the community might be smaller. It might not be in the most desirable area. Sometimes location doesn't really affect that price. As an example, also on the other end of the spectrum, a community like South County for us that's brand new and has all the bells and whistles, their starting entrance fee for a one bedroom is around 450,000, and their starting point for the monthly fee is about $6,000. So you can kind of see there is still quite a variance here in Orange County, and of course that's going to apply across the country. A more desirable location is going to be a little bit more expensive, but still within that same location, there's going to be a price difference.
At those dollars, do you own the unit you're in, like a co-op or a condo?
Very good question, and I will say that is usually like the number two question that I do get asked. So it is not a real estate transaction. So your entrance fee is not a real estate transaction. You do not own the property. What you are buying into is a guarantee of care for the rest of your life. And this kind of leads into the other big question. Uh, when you move into a life plan community, you do sign a residency contract. The residency contract is going to outline everything that the community is required to offer you and take care of for you while you live at the community. Our community here at Regents Point and all human good communities, in the residency contract, we talk about benevolence and we talk about having a financial security blanket if anything were to happen to your finances. So, not all life plan communities will offer this. Some of them do in a different way. They don't necessarily call it benevolence. Sometimes it's a guarantee of care. For Regents Point and for our human good communities, we do have it outlined that if you can no longer afford your monthly fee, whether that be an independent living, assisted living, or memory support, we will cover your expenses. Given we need to have you apply for benevolence, we have a benevolence fund that would assist financially if you no longer can afford your monthly fee. There are life plan communities, whether it's a type A or a type B, for profit versus nonprofit, that will not offer financial assistance if you cannot afford your monthly dues. So it's an important question to ask if you are looking at a life plan community, regardless of type A or type B, if they have somewhere in their contract that you will be taken care of financially if you're going through a hardship. Don't see Joanne. She might have jumped off, but I'll continue down the question. So, uh, Are families allowed to hire private RNs? That's a good question. So, for whatever medical need, the question is, are families allowed to hire private RNs to cover type 1 diabetes care needs in all levels of LPCs? So, families are allowed to hire a private caregiver, and they're also allowed to have in-home care come in. So whether that be like a private concierge doctor, private concierge nurse, that's fine. That's permissible in the different levels of care. It just depends what they're assisting you with. So as an example, and this does not necessarily relate to type 1 diabetes, but as an example, if someone were to have a feeding tube, that even if they were getting assistance with that, they would not be able to be in independent living, assisted living, or memory support. They would have to be in skilled nursing for a need like that. Does Eric have any actual case examples to present about type 1 diabetes care in his facility? My current facility, no. My previous community, yes, at Freedom Village. So, and I said I wasn't going to use names, so now you know where I used to work, which not a big deal, but um, I had an example, I had a scenario where a resident wanted to move in. They were diabetic, they were insulin dependent. The big question was, can they handle their insulin on their own? And at that stage in their life, yes, they could. Of course, we look at, is there a possibility down the road where you would not be able to handle it? And so what we did was we basically did an addendum to their contract at that point where if they reached a point where they were not able to manage the insulin on their own, then uh, the resident would have one of two options. They would be able to move out of the community and get a refund for whatever their entrance fee was at that time, and then find a different living scenario, or they could continue living at the community with the understanding that they would need to pay for a medical professional to come in and assist. However, many times per day they would need to assist with that. So it was an addendum that was signed off and written, and we basically gave them an option depending on what the needs would be later on down the road. Okay.
To incoming residents come to meetings with an attorney, or are these talk?
Mm. That's what's the saying? It always helps to have at least one attorney in the family, right?
Right.
Um, no, most of the time, whether it's my previous community experience or here, most of the time, incoming residents do not show up with their attorney, but we do give them a sample of the residency contract well in advance. So if they wanted to take it to their attorney or a legal professional, they can do that. We give them plenty of time to review it. You know, it's a pretty if we print it out, it's about this many pages. So it's quite a hefty contract. And so we give them adequate time to review it, and of course, adequate time to review their questions.
I have to comment. Iris, Adam, and I took a tour with you, and we spoke to uh, some residents, um, and everyone was happy. Um, I didn't sense an undercurrent of discomfort in any way. And they weren't necessarily having, I assume everyone in their 80s has some medical conditions, but um, you know, I couldn't tell. But the ones we spoke with were thrilled to be there and be in the community.
Thank you. It's it's probably the number one reason why I always suggest and give the advice to visit as many communities as you possibly can, and also interact with residents. You know, the more you see and the more you chat with people, you will get a better idea of what the community's like, if the residents are happy there, maybe not so happy, how the community is managed and operated. One of the, this is a little off topic, but one of the commonalities with life plan communities is that oftentimes they are bought and sold one after the other after the other. So management changes. And for whatever reason, I will say usually it's financially driven. So a community is maybe not profiting whoever owns it and they sell it. And so there's a change in management. that change is usually detrimental for the residents. There's changes with food, with transportation, with services that were provided, and then they're taken away. So that in turn will equal unhappy residents. So another question I would ask is if you're looking at life plan communities, ask who owns it, how many times has it changed ownership hands, when was the most recent time that it changed ownership hands. So you can learn a lot just by asking those questions, and that will in turn reflect on the residents' happiness of the community.
We have a cheat sheet of questions you should ask when you tour. That was not on our list. That makes a lot of sense to me.
I would add it. I would add it for sure. Sarah asked a good question, more so diet related. So, type 1 diabetes often has tag-along conditions. How much of an issue would a gluten-free diet be for someone with type 1 diabetes plus maybe celiac disease? So, again, this is community dependent. Thankfully, at our community, we do understand that there are different diet and dietary restrictions that residents might encounter. So there's gluten-free, there's no dairy, there's vegetarians and vegans, there's low salt, there's low sugar. So all these things, we do take into account. On our menu, we do list items that contain all these possible allergens. So if somebody just doesn't like onion, it's going to be listed. Slash, if somebody cannot have gluten, it will be listed that there is wheat in something. If somebody cannot have dairy, then it will indicate that. For our menu here at Regent's Point, we always have four specials, and the fourth one is always a vegetarian slash vegan option. Now, if somebody does have celiacs, which I do understand that there is uh, heightened sensitivities with cross-contamination also. So that would be something that the conversation would have to be had with our culinary team, just to ensure that if there is cross-contamination on something, the resident is aware, but oftentimes there can be changes made. So as Iris and Joanne saw, we do have two different dining venues. A resident that might have celiacs, I would suggest maybe they dine at the bistro, which is a little smaller, and there's a little bit more of a possibility to control what is being made and what it will not come into contact with. Whereas the main dining room has the larger kitchen, and there's more of a possibility for cross-contamination.
Lori's question is really interesting. That some facilities include a receipt with the meal that gives a carb count, which is important for those managing insulin. Um, may not be done, but how difficult would that be to give you a sense of nutrients involved?
Currently, if we're just talking about my community, that would be a difficult thing to do just because the way the dining program is set up. Not to say that it cannot be done down the road. Um, Thankfully, as I might have shared this with Joanne and Iris, I might have not, but we were utilizing Morrison, a culinary company that we would outsource from for our uh, cooks and chefs and all the anything culinary related. Now we have changed to self-operated. So now we are in control of essentially all of our dining program. So this is an example of something that we could implement now that we have control of the entirety of the culinary program. But I had never heard of that, having a receipt given that, I mean, it's actually quite genius to include the
I,
carb count.
um, I discovered this. It's interesting that I live in New York State in an area with pretty good hospitals. Um, but the hospitals don't do that, which I think is kind of ironic, but um, I'm losing my nouns today. I'm 73, but and after my granddaughter was in the hospital, she was in getting additional care in another facility. And that's where I discovered they did it. And I thought, my goodness, that's real easy to do. And I asked them how they helped with someone like myself with type 1 diabetes. And they were more prepared than the hospitals, which I thought, it was a rehabilitation facility. And I thought it was, pretty genius. So throw that idea out there. You might help a few people.
I appreciate it. Like I said, I had not heard of that, but I think it is quite genius to do that for various reasons. I mean, people might just uh, need to up their carb intake for whatever reason. Maybe they need to gain weight, maybe they need to lose weight, depending on their medical professional's advice. So it's a smart idea. Definitely something to consider.
I'll throw something real quick out, just slightly off topic, but there are a lot
Okay.
of AI apps that evaluate what's in a meal. You take a picture. What the data is showing us is they can be very inaccurate. They often are inaccurate, but the hardest item to for them to get accuracy on is bread. It's very hard to assess the carb count in bread, the size of the bread, the what went into it. So that's off topic, but it's an interesting problem.
Thank you for sharing that. I do want to go back just before Lori's question. Jim did ask how much of this industry is managed by private equity investment firms. It's a big mix across the board. There are, if it's a, if it, based on my research and experience, if it is a large portfolio with, I'm going to say like over 100 communities, likely it's a private equity investment firm. The previous community I worked at, it was more mom and pop. We only had two communities. We had one in Orange County, and then we had another one in Riverside County. And from its inception, it was conception. It was made up by just these two communities. So um, that is another good question, probably if it's not on your question list of questions. A smaller enterprise will have more of that mom and pop feel. It'll be a little bit more of a family environment. In my experience, a management organization that has a lot of communities, it's going to feel a little bit more disconnected. So it's just
Mhm.
depending on how they're run. Barbara asked, do your menus include nutrient information? For example, how many grams of carbohydrate or salt are in a menu item? Currently at my community, we do not. But again, that is another example, room for growth there. And I think as more individuals, possibly with type 1 diabetes or whatever other, uh, um, um, is it okay to call type 1 diabetes a disease?
It is.
Okay. Politically correct, right?
You're
With
okay.
it, with any types of another disease, it's something that it is important to take into consideration because it might benefit them in the long run as they are living at the community. So that is a good question. Yeah. We have about 10 more minutes and we'll just keep the chat open. I do want to kind of close out on the life plan community conversation. So we covered type A and type B contracts, which uh, if you're doing research on life plan communities, you might often see there is a type C, C as in Charlie, option as well. Type C communities are more of a month-to-month option. They really, in my opinion, do not fall under the life plan um, verbiage. A month-to-month community will likely be like a rental community where you don't pay the entrance fee, so you don't have a large sum of money that you're paying up front, and they might not have all the levels of care. So a type C community might have independent living and assisted living, but they might not have memory support or skilled nursing. And same thing goes for the financial security. So you might move and in the contract, it might say if you can no longer afford to pay your monthly dues, they're going to ask you to leave. Whereas at a type A and a type B contract, usually there is a financial security blanket where it's written if anything were to happen to your finances, you will be protected, whether that be with a benevolence fund, whether that just might, it might just say you have a guarantee of care, point blank. There are financial securities involved in type A and type B, usually not so much in a type C. Good question over here, Lori. Is there a refund of the fee if someone passes shortly after the move? Yes. So typically at a life plan community, the first 90 days are your trial period. So usually within the first 90 days, if anything were to happen, whether you're not happy at the community and want to move out, or if the resident were to pass away within the first 90 days, 100% of the entrance fee would be refunded. That's typically the case whether it's a type A or type B, the first 90 days. From there on out, it's a big mix on how the refunds are managed. So at a type A contract, typically because you are paying more money up front, anywhere between 80 to 90% of it is refundable, regardless of how long you live at the community. So, you're there a year and you don't like it, you're going to get 80 to 90%. Typically, that's the ratio. At a type B community, it will change. So at a type B community, at least for us, as an example, we have three options. We have a 0%, a 50%, and a 75%. Some type B communities offer like a 25% and a 75%. So there's a little bit more of an open window for type B communities. There does come a point at a type B community where if you go with the 0%, sometimes it's also called the classic rebatable contract. After a certain amount of time, for Regent's Point, it's 44 months. After a certain amount of time, that entrance fee depreciates down to zero, and you would not get any of that money back after X amount of time. So as an example, at Regent's Point, if you were to pay an entrance fee and you go with the classic rebatable contract, after 44 months, that money has depreciated down to zero, and you would not get any of that money back. Okay, very good question. Joanne, you asked, do you anticipate this breakdown type A, B, C to change? New options, question mark, are these governed by state regulations? There is a governing board that oversees life plan community contracts. So their real technical legal term is continuing care life plan contracts. So there is a governance board that visits and ensures and does audits at these life plan communities to ensure that everything is done by the book. Do I expect changes to be made down the road for type A, type B, type C? Probably not. There's little changes every year, believe it or not. Like, I mean, minute. Like, now a community has to have three different areas where the ombudsman poster is posted at the community versus when it used to be two or something like that. It's something super minute that I don't think would make cause for drastic changes for a type A, type B, or type C contract.
And if you move in with a spouse or a partner, and you suddenly need nursing care, and something has happened, what happens to your unit? Can your spouse stay there? Do you get billed double? How does that work?
When a couple um, married, just life partners, whatever it may be, when they move in, they both join the contract together. As needs change, usually one person's needs change at a faster rate than the other person's. That's usually historically how it goes. There's options. So the person that needs a little bit more care can stay in independent living. And by the way, this is applicable to both type A and type B. The person who needs a little bit more care can stay in independent living and have a caregiver come in to assist for those extra needs. There does come a point where either need wise, they need to move to assisted living or memory support, whatever that level of care may be. Um, or it might be financially driven. So the caregiving coming in becomes a little bit too expensive. So they need to move to the higher level of care. This is where it kind of varies community to community. So both of the residents that moved in can move together to assisted living. One example. One person can stay in independent living and then the other one can move to assisted living. Or they could continue to have caregiving services come in until the second person needs those caregiving services as well. So it just varies. It's kind of dependent more on the resident needs, not so much whether it's a type A or a type B contract. Lots of information. I'm always happy to answer questions. I know that this is a very strong knit community and different questions and different topics come up. So if anyone here on this call directs their questions to Joanna, you can just send them over to me.
That I think you do a great job of giving us the real basics on how this all works. We just don't know. We've never been here before. So thank you for your time. Thank you for staying. This has been held excellent. We will share it. I'm sure there will be more questions, but really seriously, you do a great job of giving us the view of what it can look like. So thank you. Have a wonderful evening. Go
You're
play.
very welcome.
All right. Thank you,
Thank you
everybody.
for having me.
All righty.
Thanks.
Bye-bye.
Bye, everyone.